Welcome to the deep dive. Today we're tackling a topic that's, well, incredibly important for our overall health, but often flies under the radar: the crucial role of counseling.
Absolutely. And its impact on our well-being.
Yeah, and it might surprise you, really, to learn how history and economic forces in healthcare have sometimes overshadowed just how significant it is.
That's right. And for you, if you're looking to get quickly up to speed on what really matters, this is, I think, a vital area to understand.
Definitely.
We've gathered some really compelling sources for this, including some academic research that makes a powerful case for, integrating counseling much more fully into our healthcare system.
So, our mission here is to reveal just how deeply counseling affects both our mental and our physical health. And here's maybe a key takeaway right up front: it's not just about feeling better emotionally.
No, not at all.
There are actually significant economic advantages to prioritizing counseling. Okay, so to understand how we got here, let's take a quick look back. What did healthcare even look like in its earliest forms?
Well, in the very beginning, it was quite different. You often had physicians learning their craft through, apprenticeships. Hospitals were largely run by religious organizations. And interestingly, there was more of a universal approach to care. People generally received it regardless of their social standing, more or less.
Huh, that's a stark contrast to today. Then we move into the Great Depression. You wouldn't immediately think medical breakthroughs for that period.
Surprisingly, no. The Great Depression was actually a time of pretty significant medical advancements.
Really?
Yeah, just goes to show that, innovation can emerge even during really tough economic times. Following that, we saw the beginnings of how we pay for healthcare start to shift, the rise of prepayment models.
Ah, yes. Okay. The origin of Blue Cross and Blue Shield, right, back
Yeah,
in the 1930s.
exactly.
It sounds like there were actual laws put in place to allow these medical services corporations to form.
That's right. These were really foundational steps. They led towards the insurance-based system that's so prevalent today. Then World War II came along.
Right.
And this had a really interesting and lasting impact on how many of us get health care specifically through our employers.
Okay, tell me more. Henry J. Kaiser, that name sounds familiar.
Yeah, so during the war, Kaiser needed to attract and keep workers,
Oh,
for shipbuilding, aircraft industries.
okay.
His solution was basically offer free health care. This led to the Permanente Medical Group up in Northern California. That was actually the very first HMO, health maintenance organization.
First HMO, wow.
Yeah. And that model eventually evolved into Kaiser Permanente, which many people know today. And this whole idea of employers providing health care, it really took hold, especially after the HMO Enabling Act was passed in the 1970s.
So we went from care rooted in religious communities to a system largely tied to your job. That's quite a shift.
It really is.
Of course, government-funded healthcare is another huge piece of this puzzle. Medicare, Medicaid.
Absolutely. The Social Security Act of 1965, signed by President Johnson, brought us Medicare. That's the federal program, funded through FICA taxes, basically, covering those 65 and older, and also people with permanent disabilities.
Got it.
And at the same time, Medicaid was established. That's the joint federal and state program, aimed at providing health care for low-income families, children, and individuals with disabilities.
Right. And since then, we've just seen this whole array of other policies and terms pop up, like federally qualified health centers, the Mental Health Parity Act, and of course the Affordable Care Act. It feels like a lot to keep track of.
It can be,
Yeah.
definitely. But each of these was really an attempt to tackle different aspects of healthcare access and quality.
Okay.
So FQHCs, for example, were designed to serve underserved communities.
Right.
The Mental Health Parity Act aimed to make sure mental health services, including counseling, were covered similarly to physical health services, which was a crucial step, really, in recognizing its importance.
That seems key for our discussion today.
Totally. Then you have things like primary care medical homes, a Type PA focusing on protecting patient health info, and, yeah, the big one, the Affordable Care Act of 2010.
The ACA, that was a major piece of legislation. What are the key things our sources highlight about it?
Well, the ACA significantly expanded health insurance coverage. That was the main goal.
Okay.
Notably, it allowed young adults under 26 to stay on their parents' insurance policies.
Right. I remember that being a big deal.
Huge. And it stopped insurance companies from denying coverage or, charging more based on pre-existing health conditions.
So huge.
Definitely. Interestingly, it also included financial penalties for most people who didn't have health insurance for a few years, between 2014 and 2016.
Oh, yeah, the mandate.
Right. Though there were various exemptions for things like religious objections, very low income, or if you couldn't find affordable coverage options.
Okay. All this history really helps set the stage for understanding the complexities of our current system, including why it costs so much. Our sources definitely hammer that point home.
They really do. I mean, one statistic that just jumps out is that the United States spends more on healthcare than the combined spending of Japan, Germany, France, China, the UK, Italy, Canada, Brazil, Spain, and Australia.
Wow, that's a lot of countries combined.
It is. And to put it in maybe more everyday terms, we spend more each year on things like artificial knees and hips than Hollywood makes at the box office.
Artificial joints versus Hollywood movies. Yeah, that really puts it in perspective.
Doesn't it? This vast difference really raises a fundamental question about the value we're getting,
Yeah.
and how our resources are actually being allocated within the system.
And the comparison of spending per person is also quite revealing, isn't it?
Absolutely. The data shows the U.S. spends around, what, $8,000 per person on healthcare, with a life expectancy of about 79 years.
Okay.
Contrast that with a country like Spain. They spend about $3,000 per person, and their life expectancy is 82 years.
3 years longer for less than half the cost per person.
Exactly. So it naturally makes you think, what are we getting for all that investment?
Mm-hmm.
Which leads us right into why counseling, despite its pretty significant impact, hasn't always been seen as like a central valued part of our healthcare equation.
Okay, yeah, let's dive into that. Why should we really consider counseling as core specialty healthcare, right alongside, say, cardiology or oncology?
Well, the evidence is quite compelling on several levels. First off, counseling has a real measurable impact on our brains.
On the brain itself.
Yes. Research from Paquette and colleagues back in 2003 showed that interventions like cognitive behavioral therapy, CBT, can actually lead to changes in neural networks.
How so?
Well, for instance, they looked at people with a phobia of spiders. CBT actually resulted in reduced activity in the dorsolateral prefrontal cortex. That's a brain region linked to fear.
So it's not just talking about feelings, it's actually changing brain function.
Exactly. The key insight here is that counseling isn't just talk therapy. It can literally rewire aspects of our brain.
That's incredible, actual biological changes. And our sources also point to some pretty significant cost savings associated with providing counseling, right?
Oh, definitely. A 2016 study by Altman and colleagues looked at healthcare costs for patients. They tracked them for a year before they started outpatient psychotherapy and then a year after.
And what did they find?
The findings were remarkable. They saw almost a 42% decrease in work disability days,
Wow.
over a 27% reduction in hospitalization days, and more than a 21% drop in inpatient costs.
Those aren't small numbers.
Not at all. These aren't just minor shifts. They
Right.
show a really clear economic benefit to making counseling more accessible.
So it improves health and potentially saves significant money down the line. That seems like a powerful argument.
It really is.
And it seems this idea of the mindset business is also really relevant here.
Exactly. A 2011 study by Hong and Lynn Siegler highlighted how powerful mindset is. They found that students who heard stories about the struggles people faced on their way to achievement.
Instead of just the successes.
Right. Those students showed notable academic improvement, especially the ones who were initially struggling. It just underscores that counselors have, well, always been in the business of helping people shape their mindsets. And that has a direct impact on well-being and health behaviors.
That makes me think of those studies on the power of belief. How our perceptions can actually influence our physical responses. Like, wasn't there a milkshake study?
Yes. The 2011 milkshake study by Crum and colleagues. That was fascinating. They had two groups drink identical milkshake.
Identical, okay.
Yep. But one group was told it was an indulgent shake, loaded with calories. The other was told it was a healthy, sensible shake.
And it's...
The group who believed they were drinking the indulgent shake, they experienced a significantly bigger drop in ghrelin. That's the hunger hormone.
Even though the shakes were the same.
Exactly the same, nutritionally. It really shows how our beliefs about something can literally alter our body's physiological response.
Wild. And it's not just about food, right? Our perception of stress plays a huge role, too.
Absolutely. Another study by Crum and colleagues, this one in 2013, it showed that people who viewed stress as something that could actually enhance their performance.
Rather than just being debilitating.
Right. That group actually experienced less cortisol activity, less stress hormone during stressful tasks. And they were more likely to seek out feedback to improve. It's all about reframing our experiences in a way that builds resilience.
This all connects back to the placebo effect, too, I guess, showing just how interconnected our minds and bodies really are.
Precisely. Research by Howe, Goyer, and Crum in 2017 emphasizes just that. Our psychological and social environment can have a tangible impact on physical health outcomes. The placebo effect isn't just some trick with a sugar pill. It reflects our body's innate capacity to respond based on expectations and beliefs.
Right.
Even something as simple as how we perceive physical activity can make a difference, like in that hotel maid study.
Oh, yeah, I remember that one. We're just telling hotel maids that their daily work counted as good exercise led to actual physical improvements.
Yeah, exactly. Crum and Langer's 2007 study found that the group of maids who were told their work was good exercise saw significant decreases in weight, blood pressure, body fat, other health markers.
Even though they weren't actually doing anything different.
Their activity levels didn't change at all compared to the control group. It just powerfully highlights how our mindset can shape our physical reality.
So we're seeing this really undeniable mind-body connection playing out again and again. And our sources indicate just how many health issues are actually related to stress.
Indeed, it's estimated that a staggering 60 to 90%, think about that range of all visits to primary care physicians, are related to stress.
60 to 90%, that's huge.
It is. Furthermore, lifestyle factors which are heavily influenced by our mental and emotional states contribute to over half, 53% of all deaths in the United States.
Wow.
Even weird things, like the fact that there's an increased risk of heart attacks on Monday mornings between 8 and 9 a.m.
Ugh, the return to the work week.
It points to the impact of stress on our cardiovascular health. The World Health Organization even predicted that by 2020, mental health and substance abuse issues would surpass physical illnesses as the leading causes of disability worldwide.
That's a really sobering statistic, and it underscores the importance of addressing these underlying psychological factors. Which brings us to the groundbreaking Adverse Childhood Experiences study, the ACE study. This seems like really pivotal research.
It really is. The ACE study involved a huge sample, over 9,500 participants. It surveyed adults about their exposure to various difficult experiences in childhood.
Like what kind of experiences?
Things like psychological, physical, or sexual abuse.
Yeah.
Also, household challenges like substance abuse, mental illness, domestic violence against their mother, or criminal behavior in the household. The findings, reported first by Felitti and colleagues in '98, and then expanded on by Burke and others in 2011, were profound. The critical insight from the ACE study is that early childhood adversity has these deep, lasting biological and psychological consequences. It dramatically increases the risk for a whole range of health problems in adulthood.
And what specifically did they find about that link between the childhood experiences and later health?
Well, they found a strong correlation, a dose-response relationship, actually. The higher the number of ACEs a person experienced, the higher their risk for negative health outcomes later.
For example?
For example, people with 4 or more ACEs had a 12-fold increase, 12 times the risk for things like alcoholism, drug abuse, depression, and suicide attempts.
12-fold. That's enormous.
It is. They're also significantly more likely to have behavior and learning problems as kids and obesity later on. Compared to someone with 0 ACEs, someone with 4 or more was 51% more likely to have those issues.
That really highlights the long shadow these early experiences can cast. Our sources also touch on the biology behind this, how it actually works.
Yes. Research suggests that early trauma can actually affect how our genes function, specifically the genes that regulate our stress hormones.
How can trauma change genes?
It doesn't change the genes themselves, but how they're expressed. It happens through a process called methylation. You can think of it like tiny chemical tags attaching to our genes.
Okay.
These tags can basically turn genes up or down, altering how they work. In the context of ACEs, it looks like early adversity can lead to changes in these methylation patterns on genes involved in our stress response system.
Making people more vulnerable to stress later.
Potentially, yes,
Right.
making their stress response system perhaps overreactive or dysregulated. Meany discussed this in a New Yorker piece by Paul Tuff. And what's really striking
Yeah.
is that even individuals with high AC scores who managed to avoid other big risk factors like they didn't smoke, didn't drink excessively, weren't obese,
Yeah.
they were still over 300% more likely to be at risk of heart disease.
Wow. So even with healthy behaviors later, the early experiences still carry that risk.
That's what the data suggests. It points to these really deep, lasting physiological effects.
Which just underscores again why addressing emotional well-being through things like counseling is so incredibly important.
Exactly.
And our sources also highlight the very real, measurable benefits of expressing emotions and getting counseling right.
Absolutely. The evidence for effectiveness is quite strong. Studies have shown really impressive success rates for psychotherapy in treating conditions like irritable bowel syndrome, IBS. Around 80% of patients get significant relief,
80% for IBS, that's amazing.
isn't it? Research by David Spiegel back in 1989 found that women with metastatic breast cancer who participated in supportive group therapy lived, on average, twice as long as those who didn't.
Twice as long, just from group therapy.
Alongside their standard medical care, yes. And work by Ellis Domar showed a big improvement in conception rates for women struggling with infertility who were in group therapy, a 55% success rate compared to controls.
Wow. Fertility, too.
Yeah. And in mental health, studies have found that CBT can be just as effective as adding a second antidepressant when the first one isn't quite working.
So it's a viable alternative or addition to medication in some cases?
It seems so. These are really encouraging findings across a wide range of health challenges.
These really are.
And, a large Consumer Reports survey back in 1995 found similar things. People generally felt they benefited substantially from counseling.
You okay?
And those who engaged in longer-term therapy reported even greater improvement. Interestingly, that survey also found that psychotherapy alone was often rated as effective as combining it with medication for many conditions.
So people felt it worked well on its own, too.
According to that survey, yes.
Yeah.
And other research, like from Lambert and Katani Thompson in '96, suggests many people experience positive changes fairly quickly, maybe in just 5 to 10 sessions.
That's not a huge commitment for potentially big results.
Right. And these benefits tend to last. Now, some people, maybe 20, 30%, might need longer treatment, of course, but the overall impact is significant.
And we even have examples like Dean Ornish's work, showing reversal of physical diseases with approaches that include psychological support.
Yes, Dr. Ornish's research was groundbreaking. He showed that even coronary artery blockage could be reversed without surgery through comprehensive lifestyle changes.
What did that involve?
It's a combination: a very low-fat vegetarian diet, exercise, meditation, yoga, and, crucially, group therapy for social and emotional support.
Group therapy was part of reversing heart disease.
It was a key component. It really highlights the powerful role of mental and emotional well-being in even severe physical conditions. And then there's Pennebaker's research on expressive writing.
Ah, the journaling study, just writing for like 20 minutes a day for a few days.
Exactly, 20 minutes for 4 consecutive days. That simple act was linked to improved immune function, people getting reemployed faster after being laid off, lower blood pressure, even increased coherence in brainwave activity.
Just from writing down thoughts and feelings.
Seems so. And finally, just to kind of wrap up the evidence, the American Psychological Association passed a resolution back in August 2012.
Okay.
It explicitly recognized the effectiveness of psychotherapy. They highlighted that the benefits often continue even after therapy ends, that it works in real-world community settings, not just labs, and that even brief interventions can be really helpful.
So a strong endorsement from the main professional body.
Definitely.
Okay. So as we bring this deep dive to a close, it feels really clear that counseling isn't just some, optional add-on. It seems like a fundamental pillar of our overall health and well-being.
I think the evidence points strongly that way. We've looked at how historical and economic factors shaped our healthcare system, maybe sometimes sidelining the profound influence of our mental and emotional states.
Yeah, and we've examined this really strong evidence supporting counseling's positive impact, not just on mental health, but physical health outcomes too, and its potential to reduce overall healthcare costs, plus the lasting benefits.
Those surprising facts really stick with you, don't they?
Yeah.
Like therapy leading to actual neurobiological changes.
Well, in the brain. And the physiological effects of mindset, like with the milkshakes or the hotel maids, it's powerful stuff.
It really is.
Yeah.
So this whole in-depth look at the evidence, it really prompts a crucial question for you, the listener.
Yeah.
Considering this compelling evidence for how tightly our minds and bodies are connected and the huge impact of psychological factors, what are the broader implications, for how we think about and approach healthcare and well-being, both for ourselves, individually, and maybe as a whole society?
That's a great question to leave people with. Definitely something to mull over.